Welcome to the Digital Health Digest video series. Today I'm joined by Lloyd Humphreys, and he is the Managing Director of Cogniss, a no-code ecosystem built for creating digital health solutions without the need for developers. Hi Lloyd, how are you?
I'm very well indeed. Thank you very much, Alice.
Thank you for joining me. For those of you that don't know Lloyd, he began his career in the NHS before founding Breakthrough Online, the very first digital therapeutic for addiction. Since then, Lloyd has gone on to help many healthcare ventures scale and also mentors and advises startups, international accelerators, and global organizations. I know that there is so much more to say about you, Lloyd, but I hope that did some kind of justice. But in case it didn't, is there anything that you wanted to add to that?
No, that's all good. I'm sure we can dive into various elements as we go along today.
Brilliant. Well, look, I kind of touched on Cogniss in the intro. I would imagine that most of my viewers know what a no-code platform is, but in the context of digital health, can you give us a bit of an idea of what it means and why it's gaining so much traction right now?
Yeah, well, it's interesting that you said that most of your listeners would be familiar with no code, because if we rewind just a couple of years, then actually this wasn't a known phrase. It was something that was a bit left field, etc., a bit quirky. And so it's fantastic that the awareness of no code has really come to the fore. And so there's lots of reasons for that, which I can kind of dive into now. I guess kind of the thing around no code is there's so many different flavors of it right now that it's probably worth just diving a little bit firstly into kind of what is no code, what isn't it, and some of the comparisons of different things that there are available on the market right now. So the first place I normally start is in the past. Again, if we rewind just even a year ago, what you would find is people would kind of lump low code and no code together. And they're very, very different things. And so if we kind of take it on a journey in terms of how we've got to where we are with no code, in the past, you would have your traditional software development, which was all code-based approaches to kind of software development. And then we kind of then moved, well, actually, from there, you kind of then went to open source. So rather than kind of coding things from scratch, you'd kind of go to GitHub or somewhere else and you'd kind of use open source software to
Yeah.
drive your platform. And then we kind of get into low code, which was, all of these microservices that you could kind of bolt together, etc. Now, low code is quite interesting because it takes you a lot of the way, along the journey, but you still need some technical resource to knit all of those microservices together. So low code is great in terms of reducing your kind of technical need in terms of software development expertise, but it doesn't take you all the way across it. And often low code is often used for sort of back office systems, admin systems and things like that. Whereas no code takes you all the way there. So true no code should mean that you don't need any kind of technical expertise whatsoever. You need no software developers, in the mix. And that's kind of really the benefit of this, that actually you can start to get started with creating digital health apps without any need for that technical resource. However, even within no code itself, there's so many different, again, types of flavor available, even within no code itself. And we often get, asked, well, how does Cogniss compare to this or to that type of an approach? And so even within no code, you've got different types. So the first type that I talk about is sort of enterprise no code, the things like kind of Microsoft Power Apps. And these are kind of great internal tools, to kind of create internally facing kind of solutions, which can help with productivity, efficiency, and all of those things. But they don't really tend to are able to kind of scale outside of that. They're very much internal facing. So, they don't appear on the app stores, etc. They kind of tie you into an existing kind of enterprise architecture ecosystem, etc. Then we kind of have more generic types of no code. And these are really great, in terms of, being able to be, accessible to pretty much everyone. So within that, you've got solutions like Bubble, and Flutterflow and things like that, which are kind of really good for being able to kind of create an MVP. But when we think about digital health, they fall flat pretty quickly. So firstly, they're often mobile optimized web apps. So they're not native. So they're pretty, flawed in terms of the things that they can do. It's, for example, tapping into the hardware and software of the device, doing simple things like notifications. But crucially, not just in terms of the technology behind them, but also in terms of their ability to deal with really sensitive patient identifiable information. So within healthcare, quite rightly, we have quite stringent rules and regulations and compliance, and none of those are built for those sorts of approaches because they're sort of mass market solutions. And then more recently, we've seen this whole kind of movement of what we call vibe coding, sort of AI, natural language kind of app builders. And these are really fun things to do on a Saturday or Sunday afternoon if you've got some spare time on your hands, where you can kind of describe your app and then kind of you get your app kind of built for you. Now, those AI kind of app builders are really interesting, and they've been fantastic for people like Cogniss, because what they've done is they've highlighted the art of the possible. They've kind of highlighted what you can do. But again, they're kind of really flawed in terms of when we think about healthcare, because what they do is they aren't really strictly no code, in the sense that what they're doing is they're generating lots of code. So what they're doing is basically taking your words and then creating a whole code base underneath it. And then that code base runs your app. Now, the problem with that is, if you're not technically savvy, how do you know what that code is actually doing? How do you know kind of whether there's vulnerabilities in there, there's kind of weaknesses in there, there's spurious lines of code in there? You have no idea kind of what's going on. And it's not kind of scalable, because if you build two apps, you've got two different code bases, you know, etc. If you build an app for this platform and then one for that one, you've got different sets of code that you need to kind of maintain. So whilst they're kind of really good in being able to drive kind of attention, they're just not kind of useful in terms of being able to kind of drive digital health solutions. And so kind of what Cogniss is very much a really specific solution for creating digital health apps. And so we've built it from the ground up to handle all of those things, like your privacy, like your security, like the regulatory compliance. But also, there is no kind of code. When we talk about no code, it is true no code. There's not a line of code that's being created. What Cogniss is a component-based approach to it. So you switch on or switch off different components, you upload your content, you kind of design the look and the feel, and you kind of create your pathways, etc. And then when you click Save Changes, that app is created live instantly for you. But there is no code behind that. It's just one kind of architecture that we're switching on or switching off different components, which makes it highly kind of scalable. So when iOS goes from 17.3 to 17.4, we just kind of update it once, and every app that's been created on Cogniss kind of benefits from that. So that's kind of how you can get that sustainability, scalability when we're thinking about kind of digital health. And I think it's kind of, and to the second point, in terms of why is it gaining traction now? I think because of two things. I think the first one is that there is such a need for digital transformation in the NHS and health systems around the world. And we can see that from the NHS 10-year plan last week. Digital was literally kind of the heart and soul of that document. The need to drive efficiency, capacity, and clinical outcomes is literally centrally kind of predicated on kind of the need for digital transformation. And so there is that need. And if we're going to kind of meet that 10-year plan, and we're going to create hyper-localized and personalized technologies, then we need faster and better and cost-effective ways kind of create those technologies. We can't afford to keep going buying expensive commercial off-the-shelf products that are for the mass market but don't really solve local issues. And so the demand is there. And then if we then think about kind of on the ground, I think clinicians and patients are kind of fed up with point solutions, the fragmentation that's going on, that they're kind of given all these different apps that they need to kind of download, etc. And they're designed for everybody, and being designed for everybody, they're designed for nobody. And that's kind of really kind of clear, where a lot of these kind of solutions have been dealt with for, let's take mental health, for example. An app for depression treats everybody's experience in exactly the same way and treats everyone's recovery journey in exactly the same way. It takes no account of individual differences, your unique experiences, and all the things that you bring, to that mental health issue. And so people are fed up with, everyone falling into the same bucket. And so, clinicians and patients are looking for those ways of being able to kind of create tools that actually fit into their pathways, that fit into their ways of working, and from a patient side, actually fit into who they are and how they are experiencing that particular condition.
Yeah, thank you. I mean, there are so many questions that I have in so many different areas of what you just said there, Lloyd. I wanted to just talk about something that you mentioned there, which is the need for like a personalized solution. I mean, when we look at healthcare traditionally, right, it's always been very personal. You go and see a GP, they're looking at your condition, they're giving you treatment based on what you're experiencing yourself. So how important is it with digital health solutions to kind of mirror that experience and be super personalized and tailored to your specific condition and how you're experiencing it?
It's absolutely fundamental and really difficult to achieve. And I'll tell you, there's a really good example from about 20 odd years ago, just slightly less than that, when I was at Breaking Free Online. And I remember when we created the first digital therapeutic for addictions. There had been one kind of digital therapeutic before that called Beating the Blues. It was for depression. And we were kind of the second to market but the first in terms of addictions. And we created this around about 2009, 2010. And we kind of created this to really help drive kind of substance misuse, etc., in terms of overcoming that substance misuse, I should say. And one of the things that we wanted to do was to make this as affordable as possible. So we wanted this to be VAT exempt, because then that would mean it was 20% more cost effective for everyone that could use it. And so we had to convince the VAT and HMRC that this was a treatment rather than just a software program, because software you have to pay VAT on, whereas treatment, psychological treatment, is VAT exempt. If you go and see a therapist, that you don't have to pay. If you see them privately, you don't pay VAT on that. And so we had the person from HMRC come into the office, and they said, well, this is just software. And at best, it's basically you've taken a book on therapy and you've translated it to a digital medium. And we kind of came up with this example and we said, right, that's not true. Because one of the biggest predictors of outcomes for mental health is your therapeutic relationship, your therapeutic alliance. Over and above whether you get CBT, psychoanalyticals, mindfulness, whatever, your therapeutic alliance and your relationship with the therapist professionally determines your outcome. And so having that relationship is fundamental. So I came up with the example to the chap from HMRC. I said, right, okay, if you're seeing a therapist in person tomorrow, and you wake up and you forget to see your therapist, and you get to the end of the day and you kind of think, oh, darn it, I've not seen my therapist. You're kind of really quite upset by that, and you kind of feel, guilty, and you have some emotional reaction. Whereas if you kind of then left your mobile phone at home and you realize that probably about 10 minutes into leaving home, how are you feeling all day? You're feeling lost, you're feeling, bereft, you're kind of really quite anxious. Your emotional reaction these days, sadly, is probably stronger to leaving your mobile phone at home than missing an appointment with your therapist.
Yeah,
which shows you have a stronger relationship to this darn thing than you do to a mental health professional. Yeah. And so if a relationship determines it, can your phone build that relationship? And so through that response, we actually kind of was the first ever kind of digital therapeutic to get VAT exemption status. And so the reason for kind of highlighting that story was purely because we have that relationship with our phone, and we can either kind of build on that in terms of the positive influence that can have, and the engagement and the motivation that it can drive towards better healthcare, or we can actually kind of create solutions that ignore all of those factors and turn someone off. I mean, how many times have people downloaded an app and said, oh, that's a bit ugly, or oh, that doesn't work for me, and they switch it off and it just sits on their phone or it's deleted. So creating those solutions that are hyper-personalized are really key. But they are incredibly difficult to do because, as I said, to your first statement around kind of, everyone builds, an app for absolutely everybody. And therefore, they build an app for nobody. Now, algorithms and all of that are getting better and better at being able to kind of personalize them. And Cogniss, we have what's called a behavior engine, which can drive really kind of hyper personalization. So you can kind of drive a user experience, how based on how they're using the app and all of those things. So Cogniss kind of helps with all of that active engagement alongside things like nudge and gamification and all of those things. You can build really highly engaging apps. But equally, you could build micro apps for micro populations, which are just not possible en masse. So being able to build an app for someone with rare disease, for example. So if we take lysosomal storage disorders, LSDs, as an example, Pompe and Gaucher disease, you might only have 500 to 2,000 people in the UK that have that rare disease. Now, no one's going to build an app for that because there's no commercial strategy that's going to allow them to get a return on that investment in traditional software coding. But with no code, it's so cost effective that you can build apps for 10, 50, 20, 100 people, and it be kind of cost effective and sustainable. And so we have this opportunity now where we can create localized or targeted solutions quickly and cost effectively that really feel that it's been created for that individual. And in doing so, you're going to drive that motivation. You're going to build on that relationship and you're going to get the engagement. And in doing so, you're going to drive the outcomes that you wanted in the first place.
Nice. I mean, this sounds like it could be really revolutionary and have huge, impacts on patient outcomes as well. I guess like when we look at the flip side and the people who are involved in delivering, receiving, and creating the digital health solutions, how does that impact them, particularly say if we're looking at software engineers who have been traditionally involved in creating these apps? How does it then, shift that power away from them, and what impact does that have on the industry?
Well, I guess there's a few facts in terms of, we're never going to, no code is not going to put everyone out of a job.
Yeah.
It's like the calculator didn't put out accountants out of a job, did it? And so it's never going to really kind of, but there's always going to be kind of technologies that are requiring highly kind of bespoke, highly tailored kind of software development processes. That's always going to be the case. But that's kind of that's great. And what no code does is allow you to fill those gaps, and there's huge gaps. So we have apps for diabetes and depression and things like that. It's becoming a commoditized market. But what about those rare diseases? What about those communities? So this basically levels the playing field. It bridges the digital divide, and the digital divide is multifactorial. But one of those things is solutions are just not being built for huge swathes of the population, which can, that we need to do. So this is one great way of being able to bridge that digital divide. So that's kind of the first thing. But the other thing is I love the kind of the democratization, the leveling of the playing field, because in the past, what you would find is technologists had all the power in the sense that they were the ones creating these solutions. So they're the ones that were kind of building all of these tools. And they were thinking, right, well, here's a problem in healthcare that I think exists. And here's the solution that I think is going to kind of fill that problem. And in the worst case scenarios, what they do is I've got this solution, let's retrofit a problem so I can sell it. And what kind of no code allows you to do now is shift the kind of the power from the technologists creating the solution to people with frontline experience or lived experience. They're the ones that know what the problems are. And if we can flip that kind of power dynamic and allow them to be the architects, let them create solutions that solve their problems, that meet their needs, then actually you're getting a round peg in a round hole. And that kind of then, really, again, shifts the power of kind of the digital, making them, again, much more effective.
Do you think as a result, then you'll see I mean, it's great that everybody can create a solution that matches their need, right? But do you think as a result, you might see like a flood of unvalidated apps? I guess app fatigue has been a topic over the past few years, or do you think this is just part of a process of decentralizing innovation and having more personalized experiences?
Yeah. I think we're tired of bad apps.
Yeah.
And I think we're tired and have fatigue of ones that don't talk to us in the sense they don't connect to us, and make all of those assumptions about our experience. And so we have fatigue from that. We also have fatigue from being pointed in a million different directions and not knowing which ones are there. I think the statistic is that there's about 350, 360,000 apps, and about only 20% of those reach any sort of baseline for quality, which means 80% are at best ineffective and at worst dangerous. And so we're kind of tired of bad apps that are ineffective, or don't kind of meet our needs. And that's, part of that reason is because technologists have been creating them. And so again, if we flip that power dynamic, and help kind of those at the front line and those with lived experience kind of create these in combination with healthcare organizations, then you're going to get more high quality solutions coming through that meet the needs of more people. And I think that's the right thing to do. Now, one of the interesting things about Cogniss is, we're actually also solving some of that fragmentation, because we have the idea of what we call a super app. And what that is one app on the App Store being a gateway to lots of other apps underneath it. So a hospital could have, one super app, and that could be then, all of the apps that they create held in one place. So a patient or a citizen doesn't have to go and hunt for all these different, they're all in a single place. So you reduce that fragmentation. And that's at the top level. Underneath all of that, at the back end, that has some really significant kind of benefits, because part of the problem and why it's so slow to get digital adoption is because we have to evaluate all of these different point solutions coming in. So is this app over here compliant with this? Is it safe and is it secure? And oh, is this one over here safe and secure? And oh gosh, I need to integrate with this one over here and I need to integrate with that one over there. Whereas actually, if you have a common platform approach, once you kind of then have, you've done your security and privacy and all of those things on the architecture, the platform, all of the other ones kind of comply. And so you need to do a lot less kind of due diligence on those. And if you integrate with one, you can kind of technically integrate with all, and you can choose which ones you switch on or switch off. And so it makes kind of the management of that much better, much less fragmented. So at a user experience, it's less fragmented. And at a kind of an IT level and a management and asset and digital portfolio perspective, it makes it much easier too. And so this is kind of why we talk kind of about platforms and ecosystems as a way to kind of solve some of that fragmentation. So yes, so yeah, multifaceted answer to that.
Yeah, no, great. No, and you're not just seeing this across like digital health. I guess you're seeing kind of like a consolidation and the need for like one digital front door in multiple areas, like medical imaging, for example. You're seeing a lot more sort of platforms and marketplaces coming to the table where they host everybody else's solution and make it a lot more easier for the end user. So that's really exciting to see Cogniss doing that in the digital health space as well. Something that you've kind of touched on there and is at the top of my lips, and probably anybody viewing this, is just around the regulatory standards and how that is upheld. It sounds like you've got an infrastructure that sort of manages that as the solutions come through, or that they immediately comply with as they're being built.
Yeah, no, absolutely. And I'll touch on that. I'll just pick up just in terms of, one of your previous observations around kind of having a digital front door and having a single kind of access point. And obviously the NHS 10-year plan says the NHS app is going to be that single point in. And solutions like, the question we get, well, how does Cogniss kind of fit into that? And obviously, feeding into things like the NHS app and having that as a gateway into that Cogniss ecosystem is absolutely kind of front and center in terms of the ambitions here as well. So for us, we're kind of complementing that as well. And there was the mention of health store, for example, with the 10-year plan, being able to kind of really fill that with solutions that have their evidence base, that have their kind of a platform approach, makes it much simpler to kind of create that health store if, again, you've got a common architecture, a platform that underpins it. So everything that kind of Cogniss does is really about kind of feeding into that digital transformation. So that's kind of the first thing. And forgive me, I forgot the question actually. So,
No, it was just more about in terms of the
the
regulation.
regulation. Yes. Yeah. So the regulation is really key, and the compliance, and that's kind of why, Cogniss, one of the other questions we often get asked is, well, can this apply to other areas other than health? And whilst it can, actually, we built it specifically for that. So making sure that all of those things that are really important. So making sure that you're kind of Cyber Essentials Plus, making sure that you're kind of GDPR, making sure that you're handling kind of really sensitive data in a secure and compliant way. All of those things are built in by design into Cogniss, which helps people kind of leap forward in terms of their app development process, because they don't have to think too hard about the basic foundations of that kind of privacy created within it. Then you kind of get into some of the specific regulations like DTAC, the Digital Technology Assessment Criteria, and some of the kind of the ISO standards as well. Now, whilst we can't, and software as a medical device, for example, now, whilst we can't hold some of those on behalf of kind of the app developers, we can't have a generic approach to it. What we can do is we can help them through that process, because things like penetration tests, vulnerability scans, which can cost, anything up to £20,000, they're all included. We do those annually, on Cogniss, or even sometimes even more often. So all of those things are built in. So, they can go through a lot of these compliance and tick a lot of those boxes very kind of quickly by saying, Cogniss does this, Cogniss does that, etc. So we kind of make it as frictionless as possible. And actually, kind of working with Health Innovation East, we've kind of created a tool to help people through that DTAC process, because what we realized was that it's overcomplicated, that there's bits of information all over the place, and it's highly confusing over whether you need kind of external validation or whether you can self-certify and things like that. So we've actually brought those ideas together with, as I said, with Health Innovation East to kind of simplify that journey for people. And that's kind of our mission, really, is to lower those barriers to kind of creating good quality evidence-based digital health products as quickly, simply, as cost effectively as possible. So building those kind of innovator support tools is really kind of central to us helping people on their journey.
Yeah, I mean, I would never, I'm not creative enough to come up with my own health app, Lloyd, but it sounds pretty easy. What would be, like, I guess, your tips for anybody that is in a seat where they're not sort of technically, don't they have a technical background, but they'd be really interested in, building their own health app?
Well, it's quite interesting. You say you haven't got an idea. Well, it's quite interesting. We have when people join the team at Cogniss, part of the process of kind of coming on board and the interview process is we give people a week to build their own app on Cogniss. It's one of the few kind of digital health organizations that allow you, and kind of advocate you to get your hands dirty with the product before you join the organization. It's a great way to kind of see kind of what Cogniss can do. And we've had some great ideas come through just by saying, oh, I don't know what to come up with. And we've had, stop vaping apps come through, and people helping with residential childcare and support, and things like that. So yeah, it's really kind of fascinating to kind of see, the types of ideas that come through. In terms of my top tips, the things that take their time when people are building in no code, it's no longer the technical aspects. In the past, it used to be that, if you wanted to change the button from blue to red, you'd have to kind of, spend weeks with a software developer doing that and spend thousands of pounds making that change. Now you can literally do it in as long as it takes you to log in and click a button. So the technical requirements, now, have evaporated in terms of kind of, Cogniss and the whole no-code approach. The things that kind of take their time, are a few-fold. The first thing is, and they're three bits really. The first one is content. Often digital health solutions are quite content heavy. So making sure that you have your content ready to go. So, and making sure that that content is simplified and viable for a mobile experience, meeting the patient where they are. And so content is one of the biggest things that slows people down if you don't have it already. The next is the design, the look and the feel, because design is super important. Your branding, your kind of design ethos, etc. Means whether someone will actually kind of engage with the solution or not. So the design and the content are two kind of critical areas. And then it's about the user flow, how people are going to go through your app and experience it. And sometimes people build those things on the fly, and that kind of can take them some time. So those are the three things that slow people down. And there's some really great kind of tools in order to help solve some of those. So using even kind of digital whiteboards like Miro, or kind of what's that, Figma, for example, just to kind of design some of that user experience and user flow can really kind of speed things up. Having your content and using kind of solutions like Canva, for example, you can create incredible kind of designs with solutions like Canva now. That you can actually go so far, even if you don't think you're a designer, or if you don't think you kind of, are a user experience expert, you can go an awful long way with some of the tools that are available, and bringing those then to bear when you're kind of ready, for Cogniss can mean that you can create an app in days rather than kind of years. And the thing that takes their time is when those three things aren't ready.
I mean, it sounds like a brilliant app. I might have to have a go. So expect an email from me after this. But Lloyd, thank you so much for your time. It's been great to pick your brains and learn more about Cogniss and the work you're doing and the rise of no-code apps. If anybody has any questions, I'm sure you're happy for them to reach out to you directly.
Absolutely. I'd love to hear from people.
He's a great person to chat to and pick his brains. So please do reach out. Thank you so much for your time, and speak to you soon.
Thanks very much, Ellis.